Respected seniors, ladies and gentlemen, greetings from Patna. I'm Dr. Rahul Janaksena, consultant urologist and transplant surgeon. I shall be taking part in this debate, is pneumatic lithotripsy on the way out? And the answer to that is obviously not. I'm speaking against the motion. This is a story from Bible where little David defeats giant Goliath. Similar is the story with pneumatic lithotripsy defeating laser lithotripsy by the end of this debate. What is the meaning of the word on the way out? It means something that is likely to disappear or to be replaced soon. So what's the debate about? It's not about which technique is superior or inferior. The debate is whether pneumatic lithotripsy is going to disappear from endourology armamentarium, whether pneumatic lithotripsy is going out of fashion, whether pneumatic lithotripsy is going to be replaced by newer forms of lithotripsy. And the answer to all these questions is not anytime soon. And I'll tell you why. Since we cannot separate technology from the technique, let's discuss a few slides about the pneumatic lithotripsy, the device. Cost is an important factor in our country as patients are cost conscious. Pneumatic lithotripsy costs about 1,25,000 rupees. Laser will set you back by 20 lakhs. So there's a difference of approximately 20 times. Even shock pulse and urology are quite expensive. All these costs are factored into the cost of surgery, which is the first love of urologist, which is the most common device that urologist is going to buy when he or she enters into practice. It's obviously pneumatic lithotripsy. Even in corporate hospitals where they have laser, they still continue to use pneumatic lithotripsy because it is cost effective and it leads to maximum theater efficiency. In parts of the world where endourology has just started, what are they going to use? Most likely pneumatic lithotripsy. Pneumatic lithotripsy is a very sturdy device. It does not need any repair. It has a very long shelf life. Nobody takes annual maintenance contract or comprehensive maintenance contract for a pneumatic lithotripsy. On the other hand, laser is very expensive. You have to take an AMC or CMC for laser, and you also have to look for the disposables. For the roaming urologist, which is the device you will carry, it will obviously be a pneumatic lithotripsy. And you don't need any special plug for the pneumatic lithotripsy. So pneumatic lithotripsy is here to stay, and pneumatic lithotripsy is here to stay because it is cost effective. It is not cheap. Cheap doesn't sell, otherwise this car would have sold in millions. But it is still selling because it is cost effective, like this car. So let's discuss the technique now. This is a paper from Italy published in 2020 in which they did lithotripsy for bladder stones. And the concluding remarks are that further controlled trials should be done to see whether this can be the gold standard therapy for bladder stones. Next paper, again published in 2020 in Urology Internationalis, for lower ureteric stones. Concluding remarks are the cost and availability of laser treatment is an issue. Pneumatic lithotripsy is a viable and more cost-effective option. What about mid-ureteric stones? In this paper published in 2020, the conclusion was that stone-free rate or complications were similar, but there was a huge financial burden when laser lithotripsy was used, especially in underdeveloped and developing economies like ours. What about upper ureteric stone? This is a slightly older paper, but the concluding remarks are semi-rigid ureteroscopy and pneumatic lithotripsy is a good alternative that shouldn't yet be abandoned. What about kidney? People complain that about fragments, but here you can see that in the lower video, that in this case, with the use of Cleopatra sheath and suction, all the fragments could be sucked out. Complete clearance was achieved in less time, and patient went home satisfied. What about the safety, which is safer in the hands of trainee? Obviously, pneumatic lithotripsy. What about heat generation? There is a lot of heat generation with laser lithotripsy, while thermal injury is unlikely with a ballistic lithotripsy. Ballistic devices carry low risk of perforation. What about efficacy? ballistic lithotripsy has more rapid stone clearance time. We know that. So to conclude, pneumatic lithotripsy is here to stay because it is a safe and efficient technique, and because pneumatic lithotripsy is a cost-effective device. And let's face it, there is a blink factor with laser. People want to flaunt it by throwing money like they want to have BMW or Mercedes. My opponent will talk about limitations of the technique or technology, but is there a perfect technique or technology? With these few words, I thank you. I thank Dr. Arvind Ganpule Boss for giving me the opportunity to take part in this debate. And I also wish to thank the organizers for putting up this show in such difficult times. Thank you and best wishes for the new year. Thank you very much.